Have you ever wondered what really happens inside your body when someone starts taking Ozempic? Over the last few years, weight loss injections have become one of the biggest health topics in the world. Social media is filled with dramatic transformations. Celebrities have talked about their experiences, and medications like Ozempic seem to be everywhere. But there's something many people don't realize. Ozempic wasn't originally developed simply as a weight loss injection. Its active ingredient is semaglutide, a medication used to treat adults with type 2 diabetes. Semaglutide is also available in other formulations specifically approved for chronic weight management. So how can this medication have such a noticeable effect on appetite and body weight? Semaglutide mimics the action of a hormone, naturally produced by the body called GLP-1. This hormone plays several important roles. It helps regulate blood, sugar, and influences signals between the digestive system and the brain that are involved in appetite and feelings of fullness. As a result, many people taking semaglutide feel less hungry and become satisfied after eating smaller portions. Semaglutide can also slow stomach emptying, particularly after treatment begins. And this is where things become especially interesting. When someone begins eating much less and loses a significant amount of weight, the body doesn't necessarily lose only fat. During substantial weight loss, some lean body mass can also be lost. Lean mass includes muscle, although it also includes other tissues. How much is lost can vary considerably depending on factors such as diet, protein intake, physical activity, age, and the amount of weight lost. And preserving muscle is more important than many people realize. Muscle isn't just about appearance or strength. It helps us move, supports physical function, and plays an important role in metabolic health. So does this mean Ozempic simply destroys your muscles? No, that would be an exaggeration. Significant weight loss, whether achieved with medication, changes in diet, or other methods, can include some loss of lean mass. That's why adequate nutrition and resistance. Exercise may be important when appropriate for the individual. But muscle isn't the only thing doctors consider. Nausea, vomiting, diarrhea, constipation, and abdominal discomfort are among the gastrointestinal side effects that can occur with semaglutide. And now comes one of the biggest questions surrounding Ozempic. What happens after someone loses a significant amount of weight and eventually stops taking the medication? Does the weight simply stay off? Or can hunger return and the body begin moving back toward its previous weight? The answer is more complicated than many people think. And that's exactly what we're going to explore next. So, what actually happens when someone stops taking semaglutide after losing weight? This is one of the most important questions surrounding medications like Ozempic. While semaglutide is being used, it can reduce appetite and increase feelings of fullness. But after treatment is discontinued, these effects gradually decrease. For some people, hunger can increase again, making it more difficult to maintain the same eating patterns they followed while taking the medication. And research has revealed something important. In studies involving semaglutide for weight management, participants who stopped treatment regained a substantial portion of the weight they had previously lost. But this doesn't mean everyone will regain exactly the same amount. What happens afterward can be influenced by diet, physical activity, sleep, genetics, other health conditions, and continued medical support. And there's another part of the story that deserves attention: the digestive system. Because GLP-1 medications affect gastrointestinal function, digestive symptoms are among their most commonly reported side effects. Some people experience nausea, particularly when treatment begins or the dose is increased. Others may experience vomiting, diarrhea, constipation, abdominal discomfort, or an unusually strong feeling of fullness. For many patients, these symptoms are mild or moderate and may improve over time. But severe or persistent symptoms shouldn't simply be ignored. And then there's the gallbladder. Rapid or substantial weight loss itself can increase the risk of gallstones. Gallbladder problems have also been reported in some patients treated with semaglutide. That's one reason severe or persistent abdominal pain deserves medical attention, rather than simply being considered a normal part of losing weight. There's also an important misconception. If someone's appetite decreases dramatically, they might think, the less I eat, the better. But that's not necessarily true. Eating too little can make it difficult to consume enough protein, vitamins, minerals, and other nutrients the body needs. During significant weight loss, inadequate nutrition and lack of physical activity may also make preserving muscle more difficult. The goal shouldn't simply be to make the number on the scale fall as quickly as possible. The quality of that weight loss matters too. But there's another claim you've probably seen online. Some people say Ozempic can practically paralyze your stomach. Is that really what happens? The real explanation is more complicated and much more interesting. And that's what we're going to uncover next. So, does Ozempic really paralyze the stomach? This phrase has spread rapidly across social media, but the reality needs more explanation. Semaglutide can slow gastric emptying, meaning food may move from the stomach into the small intestine more slowly, particularly during certain stages of treatment. This effect can contribute to feeling full for longer and may be one reason some people naturally begin eating smaller portions. But slowing stomach emptying is not the same thing as saying that everyone's stomach becomes permanently paralyzed. There is, however, a medical condition called gastroparesis, in which stomach emptying is abnormally delayed without a mechanical blockage. Severe or persistent digestive symptoms should be evaluated by a healthcare professional rather than diagnosed from a social media video. And there's another organ that often appears in discussions about these medications, the pancreas. Semaglutide carries warnings related to acute pancreatitis. Pancreatitis is inflammation of the pancreas and can cause severe, persistent abdominal pain, sometimes radiating toward the back. It isn't something to diagnose yourself, but symptoms like severe persistent abdominal pain require medical attention. Then we have the gallbladder. Gallstones and other gallbladder problems can occur during substantial weight loss, and gallbladder-related events have also been reported with medications containing semaglutide. This is why looking only at the number on the scale doesn't tell the entire story. A person might be celebrating rapid weight loss while ignoring persistent symptoms that deserve medical evaluation. But none of this means semaglutide should automatically be considered dangerous. Medications are approved because evidence is evaluated to determine whether their benefits outweigh their risks for specific uses in patients. The important question is whether the treatment is appropriate for the individual and whether it is being used with proper medical supervision. There's also another issue that has become increasingly important as these injections have grown in popularity. People may see dramatic before and after photographs online and assume that losing weight as quickly as possible must always be better. But the body doesn't work that way. Adequate nutrition, sufficient protein, and appropriate physical activity can matter greatly during weight loss, especially when the goal includes preserving strength and lean mass. And then comes perhaps the biggest question of all. If semaglutide changes appetite so effectively while someone is taking it, what happens to those biological signals when treatment ends? Can the body simply remember its new lower weight? Or does it begin fighting to regain what was lost? The research on what happens after stopping semaglutide gives us an important clue, and that's where we're going next. So what happens when the medication is stopped? This may be one of the most important parts of the entire Ozempic conversation. Semaglutide can help control appetite while it is being used, but it doesn't permanently erase the biological mechanisms involved in hunger and body weight regulation. After treatment ends, appetite may increase again, and clinical research has shown that some people regain a significant portion of the weight they previously lost after stopping semaglutide. This doesn't mean the medication failed. Obesity is a chronic condition, and for some patients, long-term treatment may be appropriate under medical supervision. It also explains why focusing only on the injection can miss the bigger picture. Nutrition matters, physical activity matters, preserving muscle matters, and medical follow-up matters. Someone losing a large amount of weight needs more than a lower number on the scale. The goal should also include maintaining strength, adequate nutrition, and overall health. So what should we conclude about Ozempic? It isn't a miracle, and it isn't automatically a villain. It's a prescription medication with established medical uses, potential benefits, side effects, and risks. For an appropriate patient under professional medical supervision, semaglutide can be an important treatment. But using a medication simply because it's popular online is a completely different situation. The dramatic transformations we see on social media rarely tell the whole story. Behind every number on the scale is a body adapting to major changes in appetite, food intake, metabolism, and weight. That's why the most important question isn't, how quickly can I lose weight? It's, How can I improve my health safely and sustainably? And now that you know more about what semaglutide can do inside the body, we want to know your opinion. Did anything in this video surprise you about Ozempic? Tell us in the comments and subscribe for more fascinating facts about health and the human body.